Yeah, hi everyone. Once more, welcome to my channel. This is Dr. Wan again on another question and answer session with regards to GERD, gastroesophageal reflux disorder, or GORD. So I'm here to handle this topic because there was a scenario on the platform, the WAN Medical Forum, which a child of age 6 years was being treated for that disorder, and this child is still having similar issues coming up. So essentially, this small baby was taken to the hospital and was diagnosed of Helicobacter, that's H. pylori. And this child was placed on the therapy, which we call it triple therapy or quadruple therapy. That's it consists of taking 2 antibiotics and 1 PPI. So this thing was done, and it looks like the child was still burping. So I'm here to address such a situation. Similar thing happens also with adults, even those who are on quadruple therapy, meaning that 4 molecules are being used for the same pathology. So you have the European standard that we use in the EU, 3 molecules that we call them triple therapy, and the North American, they use 4 molecules, which we call quadruple therapy. That's bismuth is being added there to make the 4th molecule. So having said that, the mom of this child took the child to the hospital back there in the Cameroons, and this child was given this medication to be taken for 10 days. And after that, the child was still having similar thing. So I asked if they could run for another test to make sure that the child is no more H. pylori positive, which effectively the test was done, and it turned out that this child was no more H. pylori positive, but the child is still having issue like burping and other stuff. So I say, okay, let me answer this question. So here we go. Once you are diagnosed of H. pylori and you take either the triple therapy or the quadruple therapy, and you are off this H. pylori situation, that another test has to be done to make sure that you are no more positive. If it turns out to be negative and you're still having similar symptoms, it is no more due to those H. pylori as some clinicians might assume, but now it is what we call kind of corticosteroids building up in most cases. So normally we put patients on domperidone. So domperidone can only be recommended in situations where you are not having any cardiovascular disorder, what we call QT prolongation, or to set the point. So those are the 2 things that has to be considered first before we put whoever on domperidone. Having said that, domperidone has 2 things to do. So if you are burping, so it goes down and acts on the pyloric valve. So it gives a squabble on that pyloric valve, and you don't throw up, or how we call it, or puking. Puking doesn't come up anymore because domperidone down there does the job. Now, having said that, the acidic secretion has not been stopped. So a second molecule has to come in, and we call them antihistamine receptor antagonist. Typical example is ranitidine. So ranitidine, I would recommend it for this case, this child. So ranitidine should be in syrup, which this child has to take in order for the child to have a peaceful life. Now, for cases where they are adult, usually for adult, we put you on ranitidine 150 milligrams to be taken 1 or twice a day, or ranitidine 300 milligrams once a day in effervescence tablets. So essentially, those are the two things that has to be done. And having said that, we need to also incorporate what we call non-pharma. So non-pharma here means that you are on you are no more on medication, but you are on particular diet. Take for instance, the way the stomach is being designed. We have the intestine, the small intestines, then we have now the microvilli, we have the brush border. So all those things have to be taken into consideration. We want to make sure that you don't consume anything which is an irritant, say spicy food, chocolate, coffee, and other stuff. All those things have to be avoided in this period of crisis. Say the subject, when the subject is having issues, then those things have to be taken care of. Fresh tomato, those ones you don't have to eat them. Fresh meat, you don't have to eat them. So essentially, those are the things that I would recommend to my patients. If you are having crisis, say after your treatment for H. pylori and you are still puking, then I will tell you we go the non-pharma route. And at times we do a combination. So you are taking the medication which I listed a while ago while you are also on non-pharma route. That is, I stop you from taking orange juice because orange juice has that acidity. That's what we call alkalinity. So we need to make sure that the alkaline of the stomach is under control, because the pH value in that situation is around that 5.3, which is not a good news. It's supposed to be around that 6.5, then that's fine. But in this case, the pH value is a little bit lower, so it makes things rough for the patient. That's why orange juice, the child is not supposed to consume, even adult also. So meat, I said no, no, no. Fresh tomato, he said no, no, no. So oily food also, he said no, 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 because oily food undergo some changes, what we call radicalization. So they get into the tubes where the acids are being secreted, what we call them the HP pumps of the stomach, where the acid now oozes out. So when oily food gets there, they kind of clogging it, and then it goes further in irritating the stomach, and so more acid comes out, and that's why you find the kids or the subject, you find them puking. And so that's it. And a typical example is when you look at the shape of your stool, they have bullet stools like that of the goats. So it's a sign that the acid secretion is not the best in the stomach for such patients. When you change your diet now, you go to non-pharma, alongside with those medications, things should be fine. Duration normally for kids, they can take them for 3 to 6 months for most of the time. Whereas for adult, it is averagely 3 months, and then things come back to normal when you keep to all those rules. So that's what I wanted to address today, and I hope this video would go a long way, not only to help this mom whose son has a problem, but also to the public in general, because I know another adult called me a while ago asking questions like, hey doc, I've just finished taking my antibiotics. I've just finished the tripod therapy, which was recommended by my GP, and I'm still having trouble, kind of burning sensation in my stomach. And he did the test for H. pylori, confirmatory test, as we say. It was negative. So what can he do? So I told him, yeah, I'm gonna make a video here that will be of great help to you and also to the public in general. So far, so good. That's my contribution when it comes to GERD or GERD, gastroesophageal reflux disorder or reflux disease. Thank you so much, and please subscribe, like, and share the video. I'm Dr. WAN. Ciao.